So this week, so every week I have a focus, and this week the focus has really been on the nervous system. And so Emmy, you were in the Tuesday class, and Tui, you were in the workshop. So some of the some similar things that we'll be doing is the pelvis rocking. Yeah. So we're going to go back to the pelvis rocking and working through the pelvic floor into the organs to tone to get into the vagus nerve complex, so that we can get into rest and digest first, and then move up the ladder to get into more of an activation and dynamic movement. But because this is a somatic class, so I actually you can have your cats come and practice too. So I will actually give you a lot more freedom in how you like to express yourself or what is arising from your body. In terms of props, I would just, again, I'm going to leave that quite free for you. If you don't want to use any props, you don't have to. I can suggest like a blanket that can be made into a roll. Or if you have a super soft ball, it can be one of these muscle release ball or something that is really squishy. Or you can have a roller. It's completely up to you how you want to express yourself through it. Okay. So just the blanket will. If you don't have a roller, I always like to use the blanket as a roller. So what I do is to roll it into the burrito. Okay. So, like I said, these are completely optional. You can choose to use them at any point of your exploration. So you can slide this under your sacrum, you can go underneath, go under the ribs, you can bring it over the belly. So I like to leave that to you to decide when you want to use it. And if you don't feel the need to, you don't have to. Okay? So just bringing the screen back. So some of you are familiar with the clock already, but just to go over it again. So these 2 points here are the ASIS, yeah. So they correspond to the 2 points here, and I'd like you to superimpose the clock, a clock face, on your pelvis. Okay, so the right side of your ASIS is going to be 3 o'clock, left side is going to be 9 o'clock. The belly is going to be 6 o'clock, and the pubic bone is going to be 12 o'clock. Okay, and why I want to, the thing is, when we do visual imageries, most of the time it's easy to just start with like a 2-dimension image, which is a clock. But remember that our body is 3-dimensional. How we move through space is 3-dimensional. So at some point, so 2-dimension is easy for the frontal lobe to grasp. But at some point, maybe you can also see when does your consciousness, when does the mind starts to switch into more of the brainstem mode, in which you can then, the perception shifts, and then we move into more of the 3-dimensional body. in which breath also comes into play, and the expansion and contraction, the splendor of the breath, moves into becomes the intrinsic movement, and that the intrinsic will then guide the extrinsic. So we will begin with more extrinsic movement first, as I will guide you through to do some clock face movement of the digits, and then we'll move that into more of an intrinsic movement. And because this week we're really focusing on the nervous system, and I'd like you to also just notice how does your nervous system record this process of this journey? How does it? What happens for you? There might be sensations that come up, or there might be emotions that come up, and just see how you move through them or you move into them. Okay, so remember 3 o'clock, 9 o'clock, 12 o'clock, and then your belly button is 6 o'clock. Okay? And come and lie down on the floor. So if you're lying down on a yoga mat, I will ask that you put a blanket over the yoga mat so that you can slide and glide a little bit more freely, because the yoga mat can be quite sticky. Yeah? So let's meet you on the mat. Make any adjustments that you need to, just to get a little bit more comfortable. So I know it's 8 o'clock in Vietnam, but it is 10 o'clock in Tokyo. So you can make any movement you like, just to get so that you can find the floor, find the ground. And just register what is your body at this time. So if you want to make a little roll or twist, you can do that first. Anything to release your body weight, but into the ground. So see, I can no longer see your video, but if you like to keep it off, you can. I know that because once I move to the floor, it does get a little bit harder to hear me. I'll put the microphone down now. So is everybody still able to hear me quite well? Yeah? Great. Okay. So straighten your legs now. And have your hands on the two sides of your ASIS, or your hip points. Okay. And just check in with 3 o'clock and 9 o'clock first. So where your hands are palpating. Let's notice what's their position. Are they in line or level with each other? And then allow your breath to be a little bit more intentional without it being forceful. So letting your breath come into play. Okay, and just notice how the breath moves into the two sides or the two pelvic halves. So for me, I actually notice in my morning body how much my 3 o'clock, the right side of my hip, is so much higher than my 9 o'clock. But there's no need to adjust, there's no need to change anything, it's just observing. So that your nervous system creates a baseline reference to your body map. And then feel how much your back body is touching the floor at this point as well. So we live in a world in which there is it's a consistent sense of vigilance of having to hold ourselves up away from the ground. So just notice how much of your body is still above ground. And bringing the awareness back to the lower belly area and begin to really superimpose the clock onto the lower belly. So you can feel where 3 o'clock and 9 o'clock is quite clearly now. Now start to find where 12 o'clock is and where 6 o'clock is. You can even just take your hands there to your pubic bone and to your lower belly. Sorry, not your lower belly. To your belly button. And just resting the hands there. Notice if they are in line with each other, so that they create a part of the midline of your body. Or if there is any so-called misalignment between 3 o'clock and 9 o'clock, does it affect where the position of 12 o'clock and 6 o'clock is? And just take a few breaths here with your hands at 12 and 6. And feel into the back of your pelvis. The sacrum. Just notice where the top of the sacrum is. And where is the tailbone? How is the back of the pelvis taking the floor? Referencing back to the front of the top face. And then I'd like you to bend your knees now and have your feet on the floor. Okay, and then bring your hands to the lower belly again, and I'd like you to rotate your clock from 12 o'clock going clockwise. Find 1 o'clock and maybe make a little circular movement so you're giving yourself a little massage. Go to 1 o'clock, which is still probably a part of the pubic bone, depending on what is the bony protrusion of your pubic bone. Go to 1 o'clock. And as you palpate it in a circular motion, make it really slow and just notice sensations there. And then we can go to 2 o'clock, which is the inside of your right groin. Let's give that a little massage, circular motion. And then go to 3 o'clock again. So where the right ASIS is, you can go around the bony protrusion of your ASIS, just fit into the shape of the bone there. What does your ASIS look like in your mind's eye? And then go to 4 o'clock, just above the ASIS, and notice any sensations there. What is the shape and the soft tissue beneath? So where you move your fingers into, that will be probably your large intestine. And then go to 5 o'clock. So maybe perhaps that is, for me, that is directly underneath the rib point, maybe about 5 centimeters below the rib point, but I have a really short torso. So what is it for you? How far away from the ribs will 5 o'clock be? So you're also drawing a map of yourself. Okay, and then go to 6 o'clock. Don't poke your hands into your belly button, but just go around the belly button. So that's the small intestines. And then moving over to 7 o'clock. Perhaps that might be directly under the stomach for you. I don't know if you have breakfast or had anything this morning yet, or have you ingested what is still there. Behind the stomach is also the skin. So let's explore 8 o'clock. So it's next to the left side of your ASIS, moving towards the large intestine, or the descending colon. Then try 10 o'clock. 9 o'clock. The left side of your hip bone to see what does that feel like? What is the shape of it? How is that different from the right side? And then go to 10 o'clock, which is the left inner groin. Sensations and emotions that's arising, noticing. And then going over to 11 o'clock, which is the outside of your pubic bone, the left side of the pubic bone. And back to 12 o'clock. And just bring your hands around the clock face. Just feeling into this surface area, the skin area. Just moving around it in a clockwise position. And then through your hands, the skin of your palms, maybe touching your yoga pants and feeling into the skin that's beneath it. So the skin of the lower belly, and feel into what's beneath the lower belly. So as women, we would always have a nice little layer of adipose tissue.
commonly known as fat. So feel into the quality of that, the fluidity of that, and the gliding quality of this layer. And depending on how much pressure you are putting into the lower belly, you can perhaps go into something a little bit deeper into this, but still into soft tissue. So you're not really getting into the organs, and you're still going through the fascia. So the superficial layer of fascia there. Alright, and then just take your hands away. And I'd like you to just keep your eyes closed now and bring your awareness to this lower belly area, to the clock face, and just find the digits here. Feel into the quality of this clock. Is it still a two-dimensional, or maybe even just a one-dimensional face? Feel into the movement of your breath. Feel into the space between 12 o'clock and 6 o'clock. How they lined up. Feel into the space between 3 o'clock and 9 o'clock. So how they are lining up. And then feel into the space between each quadrant. So between 12 o'clock and 3 o'clock. 3 o'clock and 6 o'clock. 6 o'clock and 9 o'clock. 9 o'clock and 12 o'clock. So as I'm guiding you through the digits, are you really just sensing into the surface of this area, or are you able to penetrate a little bit deeper with your awareness? Okay. And let's begin to move a little. So let's move between 12 and 6. So you begin to rock your pelvis into an anterior and posterior tilt. See if you can now also allow the breath to be aligned with the movement. So what happens when you rock more towards 6 o'clock? Does it create more of an extension of the spine? And is that more intuitive for the inhale or the exhale? And what happens when you move in the opposite direction? So just moving between 12 and 6 and rocking the pelvis forward and backwards. And just notice the residual effect of this rocking movement. Is it, or instead of using the word residual, maybe if I change it to continuity of this movement, it moves into the spine and the rib cage, into the shoulders and the head. And how the pelvis is also connected to the leg bones, so it moves into the hip joints on the two sides. So how does the leg bone move in the hip joints? And then how it moves into the knees into the lower legs, into your heels, into your feet. And then let's begin to move between 3 o'clock and 9 o'clock now. So you're going more into lateral movement. See how that might even move your head. Changes the weight of your arms. Moving through the weight of your legs into different parts of your feet. So just moving between 3 and 9 o'clock. So you notice if one half of the pelvis starts to peel off away from the ground as the other half of the pelvis gets a little bit heavier. And once again, just notice how it ripples through the midline of your spine. Is it a fluid ripple? Are there any stutterings or any jarring areas? Maybe you can rock over to one half of your pelvis to a point whereby you're almost rolling over to the side without actually rolling over. But just force weight into either 3 o'clock or 9 o'clock until you feel how it takes the body over almost completely onto the side. Feel how it rolls the shape of your cranium, of your skull over to the side. So you're beginning to explore a little bit more through a three-dimensional perspective of your body. It's no longer just a clock face. And then let's get a little bit more creative. Let's begin to move in a clockwise position through the digits. And just notice if the slow you move, instead of kind of going through just moving, rocking the pelvis like this. Perhaps it's what you start with, just kind of rocking the pelvis through the digits. But if you were to pause at the spaces in between, notice how each digit takes your body through a whole cycle of movement. So it moves all the way through to the head. And if that creates movement into the arms, that maybe your arms wants to lift off the ground and reach towards the sky, or maybe it wants to reach a little bit more over the head, feel free to express that. So it's becoming more of a yawn, perhaps, or more what we call in somatic terms a pendiculation. So how does the rocking of the pelvis in a clockwise position, what does it take the rest of the body? So begin to really refine the image, the self-image of how your body is taking up space and moving through space. Now, if you were to do it the other way now, let's move it to a counterclockwise position. And perhaps just begin from the pelvis and then begin the movement a little bit more expressive through the rest of the body as you slow it right down and get curious. If you like to just also begin to explore the soft tissues or the organs that is beneath the clock face. What would the shape of the organs be like as you fold yourself into these various positions through the digits of the clock? And notice now, perhaps you might even let your torso move slightly away on the head and your chest slightly away from the ground. But don't let this be a core exercise, so you're not doing crunches or sit-up. You're just merely exploring with movement through the clock face. You can also move onto the side of your body and just notice how this, if you were to just initiate the movement through the lower belly. Find other areas or other digits to play around. So maybe you want to move from 10 o'clock to 4 o'clock. How can that be expressed as you move through gravity and space? If you were to find 8 o'clock and 2 o'clock. Maybe it might even take you all the way onto your belly as you roll through. This three-dimensional clock. But if you stay on the ground, just still stay close to the ground, so you're not changing any place, you're not coming up into sitting. And maybe you can even start to refine into the minutes. So I know that this is an analog clock and it's moving around in a circle, but what if you find where exactly is 1:30 or 9:15? So just really begin to explore how many other movements, how many other choices do we have in this little practice that we're doing. Just noticing the breath. How is your breath carrying you through? How are you riding the breath? Let's take another minute to explore a little bit more. What happens if you fold the clock into half? Can you fold the clock into half? Can 6 o'clock try and meet 12 o'clock? Or 3 o'clock try to meet 9 o'clock? And other than them meeting on the frontal plane, can we meet each other in the back as well? And what does that mean for you as you express it? Beginning to just slow down the movement, just letting the ripples settle as you come into stillness, slowly allowing the body to slow down. Still having an acute sense of the intrinsic movement of what lies beneath the skin. Just coming back to this constructive rest position with your feet still on the ground and knees bent. Whether you have your eyes closed or your eyes open, I'd like you to just use your mind's eye to feel into the quality of this lower belly area. What does your clock face look like now? What does it feel like? How does this quality translate to the rest of your body? And then sliding your legs straight. And just come back to baseline where we started. And if you like to, you can bring your hands to the two sides of your hip points, your ASIS again, and notice if anything has changed in position slightly and shifted between 3 o'clock and 9 o'clock. You can feel between 12 and 6 o'clock as well. And if you like to, just bring your hands around the clock face. You just notice if the skin quality of the skin, the texture of the skin, how has that changed too, perhaps? If you want to just palpate yourself around the clock again, notice if the sensations have changed. So for me, my experience was I had it was feeling there was some soreness on the right side of my groin, and it has kind of subsided. Feel into the spaciousness of your breath, and also how your back body is touching the floor. What's your relationship with gravity now? How much vigilance are you still holding on to levitate away from the ground? And not that levitation is a bad thing, but it's more of what are we recording? What is our nervous system recording? And how accurate is that in relationship to our reality?
So I'd like you to roll over to the side and come up to on your hands and knees and into tabletop position. So tie up your hair if you need to. Everybody okay? Alright. Now, so here you can begin with your hands wider than the shoulders and slightly in front of the level of your shoulders first, and the knees directly underneath your hips. Okay. At any point, feel free to explore other movements. Okay, I really want to keep this really free. And at any point you want to introduce a toy, feel free to do that as well. Okay, and if this takes you back to on the ground, or if this takes you back into a vertical plane, I invite you to explore that different planes of movement. This is where we're going to start. Right? So just keeping. Sorry, I think the following people are here, or the grass cutters are here. So sorry for them. You can still hear me well? Yeah. Good. Okay, so just close your eyes and instead of dumping your lower back down or tucking the tailbone under, try to allow your instincts to find this neutral space, a neutral position for your pelvis. And just feel that now that the clock is flipped, instead of when we were lying down, the clock is facing up towards the sky, now the clock is facing towards the ground. What is the position of 12 and 6 and 3 and then what is the quality between these digits? And how is your breath moving in this area? So if you were to just become more conscious of your inhale, now just feel how the inhale moves through 12 and 6, 3 and 9. And then if you allow the exhale to be really long until it's completely empty. Again, just notice how it pulls or moves into this area, and where there's, how does it relate to the rest of the body? Maybe it moves through the spine. Okay, and then you can begin to once again just rock from 12 to 6 and use that as the initiation. Feel how that movement ripples through the body. So using 12 to 6 to just get a landmark of your midline. And notice how much of your head is still in the same position. So the more vertical we get into gravity, the more we tend to hold our head, because the more we get into our head space. So just notice even as you move the pelvis, if the head does move with it, how free is the head moving with it? It can be completely free. It can hold a certain tone.
or it can be completely static. Okay, so as you move through 12 and 6, because I'm, for example, because I'm the one that is using my voice, I kind of have to keep my head fixated, so my head doesn't move very much. But you are the one listening, so how is listening changes the movement of your head position when you are actually moving your pelvis. So we're just bringing some relationships together here. And then begin to play with 3 and 9 again. So 3 and 9 in this position, in this tabletop position, I find that it can seem a little bit limiting for a start. So it's mostly a side bend that I'm moving through. But it does allow my head to be able to go side to side. So my head moves actually more when I explore 3 and 6. I'm sorry, 3 and 9. 3 and 6. But what happens now when you were to go clockwise? So, being in a tabletop position is going clockwise, encourage more movement through the 3 planes, 3-dimensional space. So that you don't only feel your pelvis going from side to side, but it's moving forwards and backwards, it's moving through the sagittal plane, frontal plane, transverse plane. Okay. And then how does that ripple through the spine to your head, and maybe that moves into the shoulders as well, and into the arms. So begin to just allow the exploration to be a little bit more creative. You want to move the arms to different positions. You can also try counterclockwise now. How does that take you through? And how is the quality of your exploration on this position, different from when you are lying down on the floor? So you can also start to find other digits and folding the clock into its 2 halves. How would that change the position that you are relating to? So how does the moving through the digits express itself through the legs? So how do the leg bones move around the hip joints? Can I'm going to take you through a rotation of your spine. So you are kind of spiraling through. So you move through a spiral. And also, I want to explore the down dog, but keeping the knees soft so that the clock fades. The clock itself has spaciousness and mobility to express. And being in the downward dog gives you more options to move. So you're actually coming a little bit higher up the ground. If you're coming off, you're moving to more levity. But can that sense of levity come from a sense of grounding through the pelvic floor? So keeping the spaciousness around the clock as you explore. And you come more into a vertical relationship with gravity now. And if you want to, you can always bring a toy in. For example, I'm keeping a ball under the foot to explore. You can use the roller or the blanket. So if you were to now initiate movement from other parts of the body, just notice how, so now I'm initiating the movement from my arm with a blanket, so I can slide around. But I'm still keeping an awareness as to how that moves through to the lower belly, so I don't lose connection to this sense of grounding that is being moved through my position. Yeah. And if you have a ball, I know that not everybody has a ball, but this is something that I really like to play with. Sometimes you don't need any toys. Maybe the body itself is already sufficient, self-contained enough to explore. So what I'm encouraging you to do now is to just create any sense of any kind of exploration. Maybe try it now through standing. How does that change your relationship with space and gravity, but just keeping this lower body area. Very much in your awareness, very much in your consciousness.
So in the beginning, we really just initiate movement through this clock phase. But now you can play with initiating movement from here and notice how that guides the more distal areas. And what happens if you were to initiate the movement, maybe just from the hand or from the head? How does that ripple back through into this lower belly area? What happens when you move fast? So the faster we move, the more our nervous system is being drawn outwards. The slower we move, our nervous system is being called inwards. But can the speed come from a sense of knowing who we are, where we are, through the grounding of the pelvis? Can even play with stability, trying to balance on one leg if that serves you. So in yoga, we often do a lot of standing balancing poses. And a lot of it it involves binding. So if you were to bind, if you were to like close the kinetic chain, so let's say you were to do dancer's pose, how does that change the conflict? If you were to do tree pose. So play around with what's familiar, but approach it from a sense of newness, a sense of curiosity. Just taking another minute or two. If you want to stay high, you want to come low, anything, you want to play with a toy. How does our sense of, how do we bring our sense of doing back to a sense of being? So most of the time we are doing because we have to, we should, and we need. But what if we just want? Want to be. Take the next minute to come back onto the around. Let's come back to a place where you are supported. And feel free to make any small movements or big movement or anything else that you feel your nervous system still needs to discharge. Maybe if you're still in your head, you can roll your head around a little bit. If you feel that there is still something stuck in your chest, you can give yourself a little self-massage. So on Tuesday and Wednesday we did wearing the gloves. So let's do wearing the stockings today. So bend your knee, bend your right knee, keep your right foot on the floor. Okay. And then if possible, I think you're already. Imagine that you're wearing stockings, pantyhose. Okay. So just take the pantyhose. Imagine the pantyhose also has compartments for your toes. So just bring that through every single toe. And then pull it up your foot. Towards your ankle, bring it up, lower leg, up the knee, up towards the thigh. It's nice if you're wearing flowy pants, you can actually really touch your own skin here. If you're able to touch your skin, it's even better. Go all the way up the thigh, behind your thigh, to the hamstrings, the inner thigh, and into the groin space. Find your sit bone, see the groin. Feel your ASIS again. Feel the space around from 7 o'clock all the way to 11 o'clock, and all the way up the belly to the belly button. Make sure you go to the back of your waistline too, so move all the way up to the center of your navel. That's how high you're going to wear your stocking. Okay. And then just shake out the left leg a little, wiggle it out, do a little shaking. Just getting the lymph to drain through into the groin and back up into the heart. And then release the left leg.
Keep the left knee bent, left foot on the floor. And just notice, before we go onto the right side, just notice if there is a different quality in the left leg than the right leg. I'm feeling my left leg a lot longer and lighter. Okay. And now let's do the right leg. Just wearing the stocking through each toe. Pull it up to your foot, the front, the sides of your ankles, back of your heels. Move it to the lower leg, your tibia, the back of your calves. Keep pulling the stockings, smoothing the stocking. Reaching the leg through, up the back of your knee, back of your thigh, sweep it all the way up to the groin. Explore the area from 1 o'clock to 5 o'clock. Go behind your glutes as well, to the small of your back, and all the way wrap it back to the center of your navel. Shake, wiggle. And then let's also wear the gloves. Do it on your own this time. Just wear the gloves through the fingers and wrists. And the gloves go all the way to the armpit, your breast, all the way to the sternum and the heart. Make sure you do the other arm too. Lots of lymph nodes under the armpits. The armpit corresponds to the groin. Move it all the way to the heart. So drain the lymph all the way to the breast area and to the heart, to the sternum. And shake the arms out. Anything else that you like to do? If there's anywhere else you feel you like to stretch out before you come to rest in Shavasana. Giving yourself a nice little massage, a nice caress anywhere else that you feel you need to be caressed. And then stretch out the whole body, legs extended, arms extended. If you need to cover a blanket over you,
bring the image of your body to your mind's eye. So noticing where you are, who you are, what's the shape of your body, how much space are you taking up, and if the floor is a mirror, how much are you in contact with the ground? How are each of your limbs laid out, if they were all an extension from the clock, particularly the legs. Feel into this intrinsic movement of your breath. Go behind the center of your navel, behind 12 o'clock, behind 6 o'clock, behind 6 o'clock where the belly button is. Just go behind there and find the source of your breath. How it expands and condenses. Into your three-dimensional being. Just allowing your breath to become more intentional, a little longer, a little deeper. Find your breath in the lower belly area. Superimpose the face of your clock into that area, noticing the breath between 12 and 6, 3 and 9, around all the digits of the clock. And initiating from this area, begin to move the body moving through the spine, into the legs, the arms, the head. Slide your feet closer together. Slide your arms over your head. Take a nice long deep breath here. Move into a yawn, a stretch. Yes, just open that jaw. Take a big yawn, stretch your jaw. And then bend your knees and give yourself a little embrace. Rock the back of the clock, so your sacrum, the back of your pelvis on the floor. So just give your pelvis a little bit more rocking. Forward. Move back up. Roll over to the side. When you're on the side, just take a moment here. Fill into the space of your belly. The space within, the space without. Slowly find your way back up to sitting. And let's do a little face massage as well. Just bring your hands to just under the eyebrows, the reach of your eyebrows. To the temple, to the hairline, see where that takes you. The jaw, behind the ears. And a little tapping on the chest, into the sternum. Make any sounds you like. so much.